This is Krok 2, 2023 May. That happened 3 days ago. Of course, the exam paper is very hard, and today we will speak about the hard questions and try to find the best answer. I tried to find the best answer by looking into Ukrainian sources, mainly because the literature in these questions depend on the Ukrainian sources. Also asking the Ukrainian doctors and of course international sources. Let's take this question first. We have here a woman, and what you need to look at in the question, we have signs of deep vein thrombosis, lower leg is edema, and there is painful to palpation. And of course, deep vein thrombosis causes a higher risk of detachment of the thrombus, causes embolism, and causes thromboembolism of pulmonary artery branches, that the embolus will block the pulmonary artery. And also another clue is that the ECG signs, which are specific for pulmonary thromboembolism, S1, Q323, it's a keyword for ECG pattern of thromboembolism, but in previous questions it was written together. Here they separated it a little bit. Next questions, I think this one's about cystic fibrosis is clear. It's just the same question in previous booklets but reversed. This was also a new question, that someone was under the rubble for a long time, and then he had no pulsation in the peripheral vessels and had signs of compression, and what we should do to prevent myoglobin in the urine and acute kidney failure. So of course this is called long compression syndrome, crush injury. The stuff in the muscles the potassium and the myoglobin can cause acute kidney failure. So what they did is putting the tourniquet, but in the hospital should remove the tourniquet to reperfuse the limb, and that's the first thing. Second thing, providing hyperbaric oxygenation for reperfusion of the affected limbs and prevention of the necrosis. So that's what they do. I'm not sure about this question. Maybe provide detoxification therapy for prevention of kidney failure. Maybe it's also a right answer. So it's between B and C, but probably B, because that was also in the treatment of crush injury, hyperbaric oxygenation. We have also here a question, and the main keyword here, percussion detects tympanitis in this region, and this was a sign of air in the pneumothorax, and this means we have tension pneumothorax. Hemothorax, blood in the thorax, will be dullness in the percussion. This is a hard question. For the last 3 months, woman suffering from pain attacks in the heart that last for 10 minutes, and the pain attacks occur in response to the slightest physical exertion. And she doesn't take nitroglycerin because of severe headache. She was repeatedly treated for ischemic heart disease, etc., etc. And what's the most likely diagnosis? So for me, and according to how I asked, it's stable angina pectoris class 4. First of all, we should exclude myocardial infarction, because this is like a pain that is for 10 minutes. It's not more than 10 minutes. And it doesn't occur at rest. So myocardial infarction occurs for a longer time. It's not related to rest or exercise. And aortic aneurysm or aortic dissection will have low blood pressure and signs of pain radiating to the back. So stable angina pectoris functional class 2. So the class of stable angina pectoris depends on the physical activity. Class 2 happens when someone does a higher than average physical activity, but here no, we don't have this. The angina pectoris happens to the slightest physical activity, so we are in the stage 4 approximately. So what we are left with is either unstable angina pectoris or stable angina pectoris type 4. Type 4 is basically angina pectoris, pain in the chest that happens at rest and or after very minimal physical activity. while unstable angina pectoris is like kind of similar. It's a newly angina pectoris that less resistance to nitroglycerin and happens more often. And but here it's for the last 3 months. This means that the patient is like kind of stability to this angina pectoris. It's not like something new onset that he goes acutely to the doctor, like an unstable angina pectoris, that he needs a higher nitroglycerin dose, that that the pain attacks occur more often. No, it's like he has last 3 months he has these pain attacks, and they are known in time. They are for 10 minutes. They don't increase in the time of the pain attack. So it's stable, but it's very severe. It happens to the slightest physical activity. That's why it's fourth stage and stable. Unstable will be for more time, will be unexpected, and will be like acutely. Here we have a woman with complaints of menstruation delay of 2 weeks, and the pregnancy test was positive. And there is no fertile egg in the uterine cavity. So here it means that she had a missed abortion, that there was pregnancy, okay, and there was missed abortion. So in missed abortion, HCG levels will be increased generally in pregnancy, but in missed abortion and in a viable pregnancy or a pregnancy that's going on, we will find HCG level in the blood. So it cannot tell us anything about is it a live pregnancy or is it a abortion that already happened. The best thing is to reveal the dynamics when we see that the HCG levels, okay, they increase in the pregnancy, and at specific time they decreased, but they are still positive. They are still higher than the average, but they are clearly decreased than the level of that of a viable pregnancy. So that tells us that abortion happened. Next question we have about a man, and basically his father has a cancer of the large intestine, what we should do to prevent cancer of this patient himself. So we do screening test for people who have higher risk of colon cancer. For those that has family history of colon cancer, we do a colonoscopy. We have here someone who is poisoned with aromatic compounds. These are basically in chemistry benzene compounds. A man fell to the floor, landing on his left side. Shortening of the left limb and external rotation of the hip are observed. The patient is unable to perform the straight leg raise test. During palpation, tapping of the heel, the patient feels pain in the hip joint. What is likely diagnosis in this case? So this is a repeated question, but a little bit paraphrased from 2011. See here with me, a 83 patient, inability of the right leg to support the body after falling on her right side. So here the type of the fall, that's fall on the one side, it can cause femoral neck fracture. Her right leg is rotated outwards. Here also we have external rotation of the hip or of the leg, and we have the positive straight leg raising sign. So it's basically that the patient cannot straighten his leg, and this is a positive test in femoral neck fracture. So for all of these reasons, femoral neck fracture. Hip dislocation, it's a little bit different. Here another question in the booklet is about hip dislocation. The type of injury is different. It's a collision, and the most important thing that the hip is rotated inwards, not outwards, like in this question. Here we have a repeat question from 2021 that to compare two groups, we need to calculate the student criterion or t-test. This is also one of the questions that I'm not sure about. We have a rash that appeared after a scratch by a house cat, and also this type of rash, they describe it and has silvery scales, And as you know, silvery scales is a key word for psoriasis. Also in the same booklet, we will see a question with silvery scales and psoriasis. I tried to search a lot if psoriasis is associated with any way with being scratched by a house cat or something, but I didn't find that. So maybe this is cat scratch disease, basically a papule at a scratch site from the cat with regional adenopathy, but this is I'm not sure of. Otherwise, it's not correct. Then silvery scales, it's psoriasis. Here we have a question that a man, he has cardiovascular diseases, and we need to prescribe him as a prevention of thrombus formation warfarin. We should control when giving warfarin international normalized ratio. This is like to control the let's say the coagulability, so his blood is not too much, there is not too much inhibition of coagulation, so that there is not a high risk of bleeding. So we calculate this ratio, and it should be optimally between 2 and 3 on patients on warfarin, so that they don't have, like if it's more than 3, then there is a high risk of bleeding, because warfarin can cause decreased coagulation too much. A baby with a gestation term of 30 weeks was born with a body weight of 1,100. 3 hours after birth, frequent opinions appeared, grasping type of breathing, etc. Additional oxygenation did not improve the child's condition. What should we do? We have here a preterm baby, 30 weeks of gestation. And preterm have a higher risk of what's called respiratory distress syndrome. It's basically a syndrome in preterm infants because their lungs are not mature. They have surfactant deficiency. It prevents the lung from extending and causes acute hypoxia or asphyxia of the newborn. The treatment, of course, this question came a lot in the booklet. The one time they ask about what we will see in the X-ray, we will see in the air bronchograms. And what we should do as a diagnosis method, it's X-ray. Also, it has another name in the booklet, it's called hyaline membrane disease. So it's a very high yield disease for Krok. The treatment for this is like 3 things. Continuous positive airway pressure or mechanical ventilation. And of course, the specific treatment is administering a artificial surfactant. So here the oxygenation didn't improve. So basically, the treatment of respiratory distress syndrome is on stages. First, we try the oxygen therapy for like milder cases of the respiratory distress syndrome. These are Silverman score 1 to 3. If it doesn't work and there is a less oxygen saturation, then we move to the next step with positive airway pressure. And if it doesn't work and we have very severe hypoxia, and it doesn't work at the positive pressure, then we use mechanical ventilation. So here we should do positive pressure ventilation. So, and there is also a similar question. Also, they ask about this same disease in the same booklet, number 55. Premature newborn, again a premature one, high risk of respiratory distress syndrome. And we have saturation of oxygen is 70. So he has already asphyxia signs, retractions, asphyxia signs, etc. And what we should do, what treatment should be chosen in this case. So here we have the oxygen support options, number B and number E, but we should first aim to the specific treatment of the respiratory distress syndrome, which is surfactant compensation and fastly after birth, which is 15 minutes and not 2 hours after birth. And after that, of course, the treatment of the asphyxia by oxygenation. Next, we have here a question about, also a new question. On the 4th day of life, A healthy newborn child developed meninina and started vomiting blood. Coagulogram reveals prolonged prothrombin time, decreased prothrombin index, and deficiency of plasma factors 2, 7, 9, and 10. What is the most likely disease in this case? So these factors also combined in the mnemonic the year 1972, like coagulation factor 10, 9, and 7, and 2. These are all activated by vitamin K. So in case of deficiency of vitamin K, this can happen in newborns. We have deficiency of these factors, and as a result of that, we can have bleeding, right? So meninina and vomiting with blood. So here it's called vitamin K deficiency or hemorrhagic disease of the newborn. It's the same thing, and you can read here about it. Person with phenylketonuria, it's like a type of congenital disease due to deficiency of some important enzymes, and we need a special diet low in phenylalanine because the person cannot metabolize this type of amino acid. Next, we have also a controversial question. He was undergoing treatment for myocardial infarction. On day 13, his chest pain increased and developed shortness of breath, etc. We have crackles under the shoulder blade. We'll get back to this. He was diagnosed with pleurisy, which is inflammation of the pleural cavity. There are high leukocytes, high ESR, high eosinophils. What complication myocardial infarction occurred in this patient? So let's see a similar question in previous booklets. So here, this person complains of pain, fever, like similar to here, temperature, pain. So it's some kind of infection after a heart attack, after myocardial infarction, also the same as in the question. Blood pressure, pericardial rub, it's a clear sign of pericarditis, yes. And there are rails beneath the shoulder blade, the same description in the question. ESR increase as in the question, ECG no dynamics. What would be the drug of choice? Glucocorticoids. So why glucocorticoids? Because this is a complication of myocardial infarction, especially 2 weeks after the myocardial infarction, like day 13, approximately, called Dressler syndrome. It's basically autoimmune antibodies against the cavities of the heart, pericardium caused pericarditis, and the cavity of the pleura causing pleurisy. As you can see here, pericarditis and pleuritis we will see in this question, and of course the treating glucocorticoids. So here the best answer will be Dressler syndrome. Pneumonia is not a common, like it can happen after myocardial infarction, but here we have like more specific symptoms as you see in the previous question. It's basically the same question, but that's how they change the question. Instead of telling you the same thing, give me the treatment of this condition, they want you to understand what is Dressler syndrome. Next, this question, I think it's clear for you. It's eczema. This one also. We have here a question that I'm not sure of. What's the amount of liquid required to diagnose pleural effusion? I asked a doctor, a thoracic surgeon, and they said 500, but also 300 I found in the internet in some sources. So this may be either of two choices. One way to know is like official answer. Infant mortality rate, this came for the first time. It's the case of the death of children under 1 year of age. Previously in all booklets, they bring perinatal mortality, which is basically in the antenatal period till 7 days of life, like this. So try to understand the questions, explore other options, how they can bring new questions based on the previous booklets. That's what we see in this booklet. Next, we have this question, also a little bit new. A girl came to the endocrinologist. She has abnormal structure of the external genitalia, hypertrophy of the clitoris, enlarged labia that resembles scrotum. She has accelerated growth as well as growth of axillary and pubic hair. So she has basically signs of puberty at 4 years of age, and this puberty, and it's not like normal puberty. It's like resembling increase androgens, increase testosterone, and lowering of the like vocal timbre, like the voice, like boys. So here we have the syndrome called 21 hydroxylase deficiency syndrome. It was present in one booklet, I think 2021, as salt wasting form. This is related to aldosterone, but here it's related to androgens. Now we will see in the diagram. So it affects school-aged, premature. We'll have premature puberty, rapid growth, and in the girls we will see signs of puberty as in the male puberty. So what happens here in biochemistry, just not too much in details, we have this enzyme that is less, and that will cause less glucocorticoids and mineralocorticoids, aldosterone, and more of androgens or testosterone, causing all of this. So what we should do for diagnosis is measuring the 17 hydroxyl progesterone levels and 17 corticosteroids excretion with the urine. So these are what we should measure, because these will increase the enzyme that converts these substances to further metabolites is deficient. That's why these substances will increase, and increase these substances is a sign of 21 hydroxylase deficiency syndrome or adrenogenital syndrome. So next we have here 3 questions about pneumonia in this booklet. We will see them. You can read the question. It's nothing specific. We have basically normal pneumonia. And for the treatment of pneumonia, it's for healthy patient, outpatient, in outpatient department. For community-acquired pneumonia, it's either macrolide, azithromycin, or doxycycline. So here, macrolides, straightforward. You can see other possibilities here, ICU, inpatient, etc. Here we see signs of severe eclampsia. We see increase in the blood pressure in the pregnant women, proteinuria, which is high, 5 grams per liter, edemas. So this is indication for cesarean section, which is severe complication of late gystosis or pre-eclampsia, severe forms of eclampsia. And also we had a treatment, but it wasn't effective. Next, also a hard question. Woman came to the doctor with complaints of a sharp pain in the lower abdomen and a short term of lost consciousness. The last menstruation was 12 days ago, and this is important number. Vaginal examination shows that her uterus is of normal shape and painless. Appendages on the left are slightly enlarged and painful to palpation. The posterior, etc. So here, the question itself, when you see it, it was present in previous booklet, but the same thing, but approximately, here pain in the left, it will be ectopic pregnancy. So the real confusion here is between A or C. And what is pedicle torsion, first of all? So torsion of the ovarian cyst, we have a cyst on the ovary that filled with fluid, and if torsion happens, then the ovary rotates around itself, and what will happen is severe pain and risk of necrosis and gangrene. And this is one previous question about this. You can see in 2019, I think, and sharp pain, elevated temperature, more intense on the light, but they didn't confuse you. They didn't bring last menstruation was on some days or no. They just bring these questions, and also they made it easier for you in 2019. Pregnancy test was negative, so that you can relax and don't choose ectopic pregnancy. But here they stepped up the difficulty, and they told you last menstruation was 12 days ago. Okay, what do you do? So for ectopic pregnancy, like the symptoms will be similar. You will have pain on one side of the appendages, on the right side. Lower abdomen will be painful, but there will be missing a menstruation. But here, missing menstruation will be like 1 month ago, 1 month the person doesn't have menstruation, or 2 months doesn't have missing 2 menstruations. But here, 12 days ago, it's delay. It's like still. It's not like enough to diagnose pregnancy. So it can be pedicle torsion in a test, in a cyst, sorry. Yes. So when the ectopic pregnancy, it will be 1 month or 2 months delay of pregnancy. Then we can suspect this. Next, also hard question. Woman hospitalized with a sharp pain behind the sternum, sensation lack of air. X-ray shows that the transverse sign of the cardiac shadow is enlarged, so the heart in X-ray is enlarged in the borders, and the cardiac contractions are of small amplitude. This is also an important thing. So what is the likely diagnosis? So the heart borders can be enlarged in both, like right and left, will be either dilated cardiomyopathy or exudative pericarditis. So the answer can be either of the two. But here, because of the sharp pain, which is not present dilated cardiomyopathy will have another symptoms like dyspnea, like signs of accumulation of chronic venous congestion, like the dilated neck veins, like lower limb edema, because the heart is in decompensating state. So that's not present here. And also the cardiac contractions are of small amplitude. So here it's maybe here you can see another question about exudative pericarditis. The X-ray picture also shows the increase of the heart borders. So, and here you can read about dilated cardiomyopathy, and it has a little bit different symptoms. So based on that, I think it's exudative pericarditis. Here also a question about forensic medicine, and always these questions are hard. 35-year-old man was found dead in his own garage. Forensic examination detects the following: horizontal close strangulation mark, petechial hemorrhages on the skin of the head and the neck, facial cyanosis, marked liver mortis, and multiple tardio spots. What indicates that the man did not die by hanging? So there are two possibilities: either strangulation or hanging. Strangulation is like basically by killing, by someone else, strangulating someone. And in this case, as you can see, it's very clear here that the marks that the strangulation will form are horizontal, right? The mark of the loop the person will use to kill someone else by strangulation will be horizontal. On the other side, hanging will be like, because of the act of gravity, the head, the loop or the rope around the neck will go upwards, and it will make what signs will make oblique sign, will make like oblique sign if it's hanging, right? If it's like committing suicide. And the circle will be not completed, a circle of the hanging. On the other side, on the strangulation, the circle of the hang will be completed because it will be like tightly done by the murderer, right? So horizontal strangulation mark is not hanging, it's strangulation, right? Multiple tardo spots, these are spots that are formed basically petechial hemorrhages, the same thing because of gravity, because when someone is like hanging for a long time, gravity, blood goes outside the vessels, etc. Facial cyanosis, of course, it's in hanging, the blood cannot go down. Liver mortis happens in general in after death. Next. This is also a new question, number 42. Person complains double vision, and she has some motor symptoms, and she has positive proserine test, make the diagnosis. This is myasthenia gravis. It's basically antibodies to postsynaptic acetylcholine receptors, and will have muscle weakness, bulbar muscle weakness, like for the muscles of the swallowing, and also for the muscles of the eyes. That's why in the question they mentioned that we have diplopia, or two images that the eye form. And the key word here, that we can reverse the symptoms using neostigmine, because neostigmine increases the acetylcholine levels on the synapse, and this can act on the receptors, counteracting the antibodies action of the myasthenia gravis. Here we have also a new question. We have after falling and hitting of the back of the neck. So when you see that, it's like some trauma. So it can be something related to the trauma. And as you can see, there are the right ear, the peripheral paralysis of the facial nerve, clear fluid from the auditory canal, and these are all signs of the basilar skull fracture. As you can see here, these can written here, you can read them yourself. Also here a new question about a newborn disease, that is we have distended abdomen, stool retention, so signs of decreased peristalsis, also delayed physical development. This is Hirschsprung disease, in which there are no nerves in the colon, and we have enlarged colon, and this area basically non-functional, and always distended abdomen, and always stool retention. Here we have a victim of a traffic accident, and we see cyanosis and problems with breathing. The right half of the chest lags behind in the breathing, and the intercostal space are widened on the right. So intercostal space are widened on the right. What does this mean? It means that there is also band box resonant, means there is increased air inside the pleural cavity, and this air is pressing on the lung and pressing on the outside. That's why the outside intercostal spaces are bulging, are widened. So it's valvular pneumothorax. It's this type of pneumothorax that accumulates air in the pleural cavity. Air enters the pleural cavity and is not allowed to exit. So it trapped there. And this is all signs of valvular pneumothorax. Hemothorax will present with dullness. We will see later a question about hydrothorax instead of band box resonance. Open pneumothorax will be like there is a signs of open wound, happens like in wound, gunshot wounds, and we will see not signs of compression or increased air in the pleural cavity as in valvular pneumothorax. This is one of the questions also that can be controversial. The 48-old patient complains of frequent constricting retrosternal pain that radiates into the left shoulder and left scapula. Pain attacks occur at night and complete rest, and last 10 to 15 minutes during the visit to a polyclinic. No ECG abnormalities and no change in the patient's general condition were detected. So it's like basically the signs of chest pain, can be myocardial infarction, and can be angina pectoris. So here it's like a kind of similar question, male that was present in like one of the old booklets. Also the same. The squeezing pain attacks, irradiates to the left hand, occurs occasionally and on physical exertion. He has had it for 1 year. Hard borders are related to the left side. Sounds are muffled, pulse. So for me, it's bicycle ergometry, basically exercise ECG. And this is like how to diagnose angina pectoris, because the person, when doing ECG on the person in the clinic, we are doing it and it's normal, right? Here they are telling you ECG, no abnormalities, because he has no attack, okay, in the clinic. But for diagnosing angina pectoris, we should do a exercise ECG, because we can simulate when the person has problems with like physical exertion, and then it causes pain and causes chest pain. We simulate this condition, and then we can diagnose like angina pectoris, or this person, after a little bit of exercise, he has like this type of pain, right? So this is, for, in my opinion, the best type of diagnosis. Here also a similar question. We have increased, a new question, sorry, increased temperature, rusty sputum, signs of pneumonia, and dullness sound in the lower pulmonary lobes, it's Cropus pneumonia. This is also a repeated question from all booklets, I think. Child was born alive. Here we have a pregnant woman, and she has a percussion revealed dull sound in the lungs. So here we have a pneumonia, but in pregnant women. As I showed you before, we use for pneumonia, for normal patient, doxycycline or as like macrolides. But here we cannot use doxycyclines in pregnant women because it can cause a problem in the teeth in the child. And it's one of the contraindicated antibiotics in the pregnancy. Also contraindicated are quinolones, like in the question we have levofloxacin. Also contraindicated, relatively contraindicated are aminoglycosides. This is from Davidson, amikacin. So the best answer is amoxicillin, like antimicrobial in pregnancy will be, first of all, like the family of penicillins. Next, we have this question about Helicobacter pylori and ulcer and hyperacidity. So for Helicobacter pylori, we should give a antibiotic, but not any one, like clarithromycin. And for the acidity, we should give an antacid from the family of prazoles, like omeprazoles. So this is the best answer. And here you can see the combinations we can use to Helicobacter pylori eradication. HLA-B27, typical antigen for ankylosing spondylitis. This question, we solved it. And next, this question, it's like depending on the Ukrainian literature, it's not like classification of international. So here we have a sign of chronic kidney failure, and they are asking for the stage. The diuresis is 2 to 2.5 liters. The glomerular filtration rate also counts in the classification, and the creatinine and urea. So creatinine and urea are normal. If you check the normal amounts, normal values, normal range. The diuresis is 2.5. Here you can see the stages. I translated them from a Ukrainian source in the internet. And you can see that the latent chronic kidney disease has like basically glomerular filtration rate 15 to 60. Compensated is like the next one. We have polyuria. We have uric creatinine still normal, and glomerular filtration rate 30 to 40, which falls in the question ranges. Intermittent will be glomerular filtration rate further decreasing, and we have creatinine already increasing. And terminal will be like very bad glomerular filtration rate of 10 or more. So this is based on this, it's compensated the best answer. Here we have also a question about pneumonia, the third question about pneumonia in the booklet, lower limb consolidation or dullness, etc. And this is like basically a normal case of pneumonia. We should give macrolide or doxycycline. And one of the macrolide examples is azithromycin. This is also one of the controversial question. Bronchial asthma, and has suffocation attacks, and during the attack he had an inhalation of, but it had no effect. So intensive therapy was unable to stop the attack, and he's transferred to the intensive care unit with the diagnosis status asthmaticus. What is the mechanism status asthmaticus? So the answer can be either A or B, but I choose B because I found in the Russian or Ukrainian literature some words about this, that they are saying about complete refractoriness or blockage of beta-2 adrenergic receptors that are already used to the like beta-2 agonists. You can read about this here if you want. Next, we have also a new question, but not very hard. A woman had an abortion. She had viral hepatitis. And this is like acute viral hepatitis 2 weeks ago. And what marker we can check in this patient if it's like acute hepatitis B infection? So as you can see here, all anti. So here they are, first of all, we can exclude hepatitis A and hepatitis E and cytomegalovirus because these are not, or let's say hepatitis A and E are not transmitted by like blood transfusion or blood complicated operations like abortion. And cytomegalovirus, let's exclude it because here we have different symptoms. And what's left for me is either hepatitis B core antigen or hepatitis B surface antibody, sorry. So here we have both antibodies. And if we check the diagram, which antibody C or S occurs earlier, we have anti-HBC occurring earlier in the disease. As you can see here, the blue one is like after 2 months after the disease, while anti-HBS 5 months after the disease, so the best answer will be the HBC. Here also one of the new questions, we have compression fracture of the lumbar vertebra, so compression fracture of the back of the spine. What aid should be? Of course, he fell from a ladder. You can find here first aid supply for the person who had like fracture of some kind. In general, we should provide analgesia, anti-shock drugs, and also deliver the patient immobilization, of course, of the injured extremity. Otherwise, there will be further deterioration of the condition. So, analgesia, anti-shock therapy, and transportation. Other also like aren't a good option. For example, in the sitting position for someone who is suffering from a back injury, this is like, don't do it. Lying on the side also, it's not, he should be flat, lying flat. So its best answer is A. Also a new question about pharmacotherapy. This patient taking this kind of drugs and then he had dry cough. And the side effect of ramipril. Of course, ramipril is angiotensin converting enzyme inhibitor, and a common side effect is dry cough. In case of this, we should give a similar drug which doesn't cause dry cough, and these are angiotensin receptor blockers like valsartan, for example. This here from Davidson, they are writing it. Okay, so to prevent the dry cough side effect. Here also a new question about Apgar scale calculating. If you calculate according to the Apgar scale here, no breathing means 0, heart rate 50 is 1 point, total cyanosis 0, atony 0, areflexia 0. So calculating all the points, you will get 1 point this Apgar scale. So like a little bit hard to remember all of this in the exam. And okay, I want to discuss this question also. I think it's controversial. On the third day, it's like a delivery, and the newborn, we have hemorrhages in the umbilical wound. Okay, and red dots on the sclera of the child's eyes. Also, they mentioned this again, subconjunctival hemorrhages in the eye. We see hemoglobin levels 155. We have here a mother which is Rh positive and B blood group, and the child's blood is A and Rh negative blood group. So here we have like no possibility of Rh incompatibility, but a possibility of ABO blood incompatibility because different A and B. But in my opinion, this is not ABO blood compatibility, because if ABO blood compatibility happens, then we will have hemolytic disease of the newborn, right? And hemolytic disease of the newborn causes hemolytic jaundice. And if you read in the old booklets, earlier booklets, hemolytic jaundice due to Rh or ABO incompatibility due to destruction of red blood cells will happen on the first day of life. Right? first day of life. And this is, we used it as a marker to differentiate pathological jaundice from physiological jaundice. We see in the earlier questions, physiological jaundice happens in the second or third day, but hemolytic disease, which is based on the incompatibility of blood group, happens on the first day of life. But here, as you can see, we have on the third day of life, we have some symptoms. This is first. So in my opinion, this is not hemolytic disease of the newborn. Second thing, here the diseases, we don't have jaundice, which is the main symptom in hemolytic disease of the newborn due to blood group incompatibility. We have just hemorrhages, right? Just have hemorrhage. Where is the jaundice? Where is the yellowish discoloration of the sclera? Where is the hepatomegaly symptoms of the jaundice? We don't see it. The third thing, I show you a question similar in all booklet about blood group incompatibility type ABO, and here we have incompatibility blood group, and we see the signs of the jaundice, hepatomegaly, jaundice. We don't see any hemorrhages, right? And also a side note that blood incompatibility because of ABO incompatibility, if we speak about ABO incompatibility, then this happens mostly because between O blood group and fetuses of A or B blood group, and not between A and B, not between A and B. So this is like something I found also. So based on all of this, this is what's causing hemorrhage on the third day. This is also what we spoke about earlier in this booklet. This is hemorrhagic disease of the newborn, not hemolytic disease of the newborn. There is a difference. Hemorrhagic disease of the newborn, this is vitamin K deficiency, causing inactivation of factors 2, 7, 9, and 10. And its onset, classical type is 2 to 7 days, as in this question. And we will have the size of hemorrhages, gastrointestinal causing vomiting with blood, and melena, and umbilical hemorrhages like in this question. So, and this baby needs what? Needs vitamin K. So based on this, I think the answer is vitamin K. Furthermore, like the last thing, administration of human anti-rhesus factor or immunoglobulin. This is, we do it for the mother as a prevention in the second pregnancy against Rh incompatibility, and it has nothing to do with ABO incompatibility. And second thing, they are here asking about what we should give to the child, so it's definitely not a right answer. If it was Rh incompatibility, then we can do the following treatment for the child. Immunoglobulin, but this not will be anti-Rh, called sandoglobulin, based on Ukrainian literature. Second question, we have also here a new question, but it's not understandable. Cancer of the body of the stomach, what we should do, surgery. Surgery of the cancer of the stomach will be depending on where it's located. If it's in the stomach body, then it's gastrectomy. If it's in the distal, pyloro-antral area, distal resection, subtotal proximal resection. If it's like cancer upper third of the stomach, like according to the localization. These are the other options, why they are not right. Next. Here we have a question about signs of abdominal enteritis, and this happens because of eating eggs, and we know what this means. It means salmonellosis, but we have here salmonella enteritis, salmonella typhi. These are two types of salmonella. Salmonella typhi will cause typhoid fever, and this is not get by eggs. This is cause typhoid fever, and by eating eggs is transmitted by salmonellas, which are not typhi. Salmonellas except typhi, like salmonella enteritis. So eating eggs, like gastroenteritis, salmonellosis. Salmonella typhi, it's like a traveler to a foreign country, and then he had some fever, and then this is called typhoid fever, rose spots on the abdomen, and so forth. And this is one of the new questions. Here we have distal interphalangeal joints. We have some pain and finger in them, and these are osteoarthritis joints, and we call them, when they are bony formations on them, we're going to Heberden nodes. Butchered nose are like bony formations in the proximal intraphalangeal joint. Here also, I'm not sure about this question, but 6-month-old child, and he's completely healthy, and what we should immunize him, according to the calendar of the Ukrainian vaccinations, we should give till the 6 months of age, we should give like diphtheria, hepatitis B, poliomyelitis, and tuberculosis, so BCG vaccine. But we should not give MMR vaccine because it's given at 12 months. And this is also according to international, checked other countries, and also it's like 12 months they give the first dose MMR. So based on this, I think he can receive the diphtheria vaccine, DTP, diphtheria tetanus pertussis, BCG, okay, but MMR, it's not like it's a little bit early, but it can be an answer, I don't know. But best answer here, based on this, what I said, it's BCG vaccine. Here also ophthalmology question, which was a new one. Person developed vision, decrease in the peripheral vision, painless decrease, and there is a gray sail. It's like very weird description for me. And we have blood vessels are without changes, so this is exclusion of the vascular pathology of the retina, because like retinal vein occlusion, we'll see it later, there will be changes, specific changes. Arterial retinal artery occlusion will be also cherry red spot, we will see now. So this gray, based on this, if you see some pictures about retinal detachment in the internet, then it has like some kind of detachment from its original place, and this grayish area here. Here we have a question that asking you to recognize that the patient lost 10 kilos and his sigmoid colon is spastic, and also other signs of ulcerative colitis. And then instead of asking you for the diagnosis, they ask you for the treatment immediately. So this is prednisone mesalamine. Here a question translated from the Ukrainian booklet of 2023, and the answer was hydrocortisone. And basically we have like a woman, she has some bleeding, and then we have less blood pressure. So the best answer here can be hydrocortisone. Maybe because cortisol can increase the blood pressure, but I'm not sure about the rationale behind this question. Here we have signs of diarrhea, peeling and pigmentation of the open areas of the body, so dermatitis. And you know from Krok 1, diarrhea, dermatitis, dementia. Here there is no dementia. It's like 3Ds. It's a sign of decrease of niacin or vitamin B3. And this is called pellagra. Here we have a question about a woman came for preventive checkups, and her mother had breast cancer, and they are asking what we should, what advice we should give her to prevent breast cancer, because she has one first-degree relative who has breast cancer, and she should undergo a mammogram once a year. This is like the screening method for all women above 14 years old of age, and also for women who have first-degree relatives who have breast cancer, and also, yes, in Ukraine. Here we have a question. Patient looks at the pattern on the wallpaper and sees the lines begin to move and form, etc. Animals instead of lighting, etc., etc. What psychopathological symptom is it? So here we should differentiate two things: hallucinations, because it can be confusing, and illusions. Illusions are distorted perception of a really existing object with changes of its contents. Like here, he's looking at some painting, okay, and the lines begins to move and form like some animals. So it's really an existing thing, but the patient is making something out of it. This is illusion, like he's seeing something out of something existing. But hallucinations are like making something completely new, okay? that the patient is like standing and he sees devil making faces. Okay, so without any real stimulus, without any looking at anything, he sees something. He sees cockroaches on the floor. So this is visual hallucination. So based on this illusions. Here we have fourth question about pneumonia, but this is asking about mycoplasma pneumonia, which is like atypical pneumonia, and also the treatment of atypical pneumonia is macrolides. Sorry. Here asking about the treatment of gout. We have the symptoms of gout and the typical localization of the gout pain, and we should decrease the uric acid, allopurinol, colchicine, and NSAIDs, glucocorticoids. We use it in acute attacks of the gout attack. Here we have a question about secondary prevention of rheumatism. We use penicillin G or penicillin 5, and it's a repeated question from 2011. Here a question that's mentioning like pain in the small joints of the hand, shortness of breath, weakness. The condition lasts for 8 years already. Objectively, her body temperature 37. She has punctuate hemorrhages on the torso, ulnar deviation of the hands, border of the hearts are shifted to the left. Systolic murmur can be detected over the apex. Her pulse, her blood pressure, etc. Erythrocyte, leukocytes, platelets, ESR, C-reactive protein. We have protein in the urine. What's most likely diagnosis? So here the question is like describing systemic lupus erythematosus, like pain in the joints. Systemic lupus can affect the joints. Also, hemorrhages on the torso and limbs. Systemic lupus can also cause like vasculitis, and also decrease of platelets can lead to the hemorrhagic rash. Systolic murmur over the apex. Systemic lupus can cause endocarditis, Liebman-Sachs endocarditis, erythrocyte decrease because of anti-nuclear antibodies. Protein in the urine, very important. The systemic lupus can damage the kidney. Only thing that's like not good from them to write in this question, ulnar deviation of the hands, because this is like not present in the systemic lupus. This is something of rheumatoid arthritis, and this can be confusing if they write about two diseases in one question. And this is like ulnar deviation. This is only rheumatoid arthritis. So, but the other description in the question, they match systemic lupus. This is also one of the new questions. We have a woman having unsteady walking, and she has nystagmus, intentional tremor, and there are some failure of the optic discs. So these are the symptoms of the multiple sclerosis, the degenerating disease in the nervous system, intentional tumor, nystagmus, optic neuritis, and also cognitive impairment. Like this here, she became reduced critical condition towards her condition, so some cognitive defects. So all of these are multiple sclerosis. Next we have potatoes. What can be the toxin to potatoes is solanine. This is like one of the questions that you cannot like expect. Here we have also a repeated question about what we should give, but instead in the old booklets they just were writing oral anticoagulants. Here in this new booklets they added oral anticoagulants and the examples and the doses, so they made it a little bit different, but it's the same thing. So we should give anticoagulants to decrease the risk of stroke. Aspirin, we don't give it in someone who has already a stroke, because he is already, according to a score, they used to define determine what we should give as an anticoagulant, antithrombotic therapy. Stroke is already 2 points, and he should get oral anticoagulants. Aspirin in case he gets 1 point. Painless ulcer, this is like a ulcer of the syphilis, so we should give treponemia pallidum test, basically the syphilis bacteria. Here also maybe a controversial question. Man complains of an intense retrosternal pain that radiates into lower jaw, occurs at rest, at night, and several times for 10 to 15 minutes. During a pain attack, elevation of the ST segment can be recorded when the ECG leads V34. What is the provisional diagnosis in this case? So we have ST elevation. We have pain attacks that are for 10 to 15 minutes, not more than this. So let's look at the answers. We have two answers, stable angina pectoris. These angina pectoris don't have ST elevation, so they cannot be the answer. Next, we have progressive angina pectoris or unstable. Also, it has no ST elevation. And what we have left is A and B, myocardial infarction and presmental angina pectoris. Both of them have ST elevation. Like myocardial infarction, we know STEMI, it's ST elevation, myocardial infarction, but also presmental angina pectoris. It's like variant angina pectoris occurs due to the vasospasm of the coronary arteries, angina that occur at rest, and can confuse with myocardial infarction. And so how we can differentiate it from myocardial infarction? We can differentiate it because here the pain attacks are like 10 to 15 minutes, while a pain attack of the heart attack or myocardial infarction will be for hours, right? And it will not go by itself. It needs hospitalization. So here we have the best answer is presmental angina pectoris because of 10 to 15 minutes, which is like the time of the angina pectoris. Again, this is like very hard questions, cardiology questions in this exam. They are asking about very tiny details, and you need to really understand the tiny difference between each type of angina pectoris, not in general what is angina pectoris. Here we have a question about pregnancy that is term, 38 weeks, the fetus already, normal birth weight, contractions are a little bit slow, but it's still the first stage of labor, and the cervical canal is still dilating, so it's managing the birth through the natural birth canal. Stimulation of labor activity and aneotomy, we can do it after 4 centimeter dilation of the uterus, because after this, then we enter the active stage of labor, and in active stage of labor, we can stimulate the labor activity and we do aneotomy, so the contraction will be more intense. But here, 2 centimeters is still early to do that, even though the contractions are a little bit slow, like for 13 seconds, it should be for 45 seconds, but we should wait for this. Cesarean section, there are no indication for cesarean section. Here it's all like normal, and yes. Next we have a newborn baby, and he has a systolic dystolic murmur. If you read the booklets, you know the systolic dystolic murmur is patent ductus arteriosus. And in a newborn baby, then you suspect congenital rubella syndrome. You can look about the other symptoms. And congenital infections, these like present in the last booklets, like 2021, they brought toxoplasmosis, which causes chorioretinitis and hydrocephalus. And they like these, so make sure you understand all congenital infections. Also, a new question, we have the abdominal segment of the esophagus in the chest cavity. So it's here hiatal hernia, the esophagus herniating into the chest cavity. Next, we have a 3-year-old boy has edemas, and then you describe the urine analysis, and we have high protein in the urine, as you can see here. So basically, he has a glomerular disease. And according to what they taught us, it is the gold standard to diagnose glomerular disease is kidney biopsy. So here we have a question that is repeated from 2008. They brought a lot of questions from 2008, about 3, 4, and there is quash somato sign. This is the, if you see a picture about thrombosis of the central retinal vein, then this is like what will be like in this. We have a psychiatric patient. He has these like excitement, stereotypical movements. And these are catatonic schizophrenia. We have burning retrosternal pain, heartburn. This is due to GERD, gastroesophageal reflux disease, and we should decrease the acidity by proton pump inhibitors, and we can see already some changes in the esophagus. The first thing we can do is proton pump inhibitors. This question describing a woman that she had uterine fibroids, leiomyoma, and then she is having some bleeding, right? So very heavy periods that impair the ability to work. So here the other options don't make sense. So basically maybe the best answer uterine fibroids. Here a question about lymphadenitis. You can read here, it's like basically the same question for 2008, but they paraphrased it. Like look here, he injured his right elbow, and then on the elbow we have hyperemia, pain and temperature, but here in 2008 it was like inguinal lymph nodes, inguinal area, so lower limb, but here it was upper limb, but basically the same thing. Here also we have a repeated question. It's all the old booklet. After the birth of twins, the postparturient woman developed massive hemorrhage from the natural birth canal. After birth, the placenta and birth canal are intact. The uterine fundus is located above the navel. The uterus to palpation does not respond to administration of uterotonics. What is the most likely cause of bleeding in this case? So the most common bleeding after birth, after labor, it's postpartum uterine atony, that the uterus is not contracting, not expelling the placenta. Here the placenta like still in the uterine cavity, and because of that there will be still bleeding. It's most common cause of postpartum hemorrhage, retained placenta, uterine. Basically, when we have a extended labor, like for 10 hours, 15 hours, so the uterus will be tired, and because of that, there will be extended bleeding, and the placenta will still be inside. The treatment will be uterine massage, using like stimulation of the uterus by oxytocin, but if not happen, then we need to do the hysterectomy. Here we did a catheterization, subclavian vein catheterization using some technique, and we administered 600 milliliters of the infusion solution. And then we had the patient condition deteriorated. So what they did is basically, or probably that they, instead of catheterizing the subclavian vein, it wasn't successful, and they made fluid enter the lung instead of enter the vein, right? And this will cause the fluid entering the lung and accumulating there. And this is evident by the dull sound in the percussion, causing hydrothorax, and not pulmonary edema, because pulmonary edema will be different, will be moist crackles, like another question in the booklet. Next question. Here we have a question about a child who has a fever, stuffed nose, small amount of mucus discharge, scratchy sensation in the throat. On the fourth day after the onset of the disease, temperature normalized, but complaints of pain in the legs appeared. Okay, the child started limping and dragging his left leg. Muscle tones and reflexes are decreased. Sensitivity is retained. What is the most likely suspected case in this? So this is a virus called poliomyelitis, affects children, and it affects the anterior motor horn of the spinal cord. And what we will see is, as in this question, asymmetric weakness. So on one side, as we see here, his left leg is affected more, and there will be decreased reflexes, hyperreflexia, decreased tones because it affects lower motor neurons, called flaccid paralysis. And of course, there will be general signs of infection or disease like malaise, headache, and fever, like in this question. So this is the best answer, paralytic polymyelitis, and of course, this will cause paralysis. For pregnant women suffering from eclampsia or seizures, we should give magnesium sulfate. A woman who has been suffering from rheumatoid arthritis for 8 months, has edema of her elbow, metacarpal, myrocarpal, and ankle joint, etc. So she has basically rheumatoid arthritis. What we should give for rheumatoid arthritis is a repeated question. We should give methotrexate and then assess according to that, and then add maybe other agents. But the basic therapy should be methotrexate. Here, again, silvery scales is disseminated psoriasis, but that question above about cat scratch may be different. Here, this is a repeated question from 2020, I think. You see that the patient is already 8 hours in the labor. She has like very low contractions, and still the fetus didn't enter the pelvis, so it's like weakness of the labor activity. Chlamydia we use for it doxycycline or macrolides. Here we have a patient who was hospitalized into the neurosurgery department with a closed cranial cerebral injury, a fracture of the right temporal bone. 5 hours later, so he was hospitalized, fracture, and then 5 hours later, the condition deteriorated, developed, etc., and dilation of the right pupil. What disease can be suspected? So this is the classical scenario of brain compression. Because of epidural hematoma, for example, we have an injury, then injury causes a little bleeding. So this trauma, the person for 5 hours is okay, but this is, we call it lucid space, like there are no symptoms in this, but what's happening is there is increase in the bleeding and accumulation of blood. And when the blood accumulation is enough to compress the brain, here when the symptoms will appear, deterioration, increase of the symptoms, the pressing on the like oculomotor nerve, for example, disabling it, causing dilation of the pupil. And then we understand that this is something very serious, brain compression. That's why everyone with a fracture who came, even if his condition is good, what we should do for MCT. So basically, I think the other questions are understandable. Here, twilight state. It's already the second time in the booklets that someone is like is in state of anger, excitement, and rage. You can read about it here. It's twilight state. Here, the last question, we have someone with high blood pressure, narrowing with the retinal vessels, causing by high blood pressure. What we should prescribe him to lower, or in general, to decrease the risk of cardiovascular disease, we should prescribe an antihypertensive drug like enalapril. Yes, so this was this booklet. If you have any questions, you can contact me. If you have any suggestion about another answers, I will be happy to hear it from you. Thank you.